mean, not all masks are created equal, right? I mean, we have a lot of masks like this that are 2 layers of cotton, for example. But we know, again, when this all started, we started to learn about N95 masks. And why is it that in some settings, wearing multiple masks or multiple layers are better than one?
Because the particle size of the virus, it is varied. And also your interaction in different situations, like how long you're staying in the environment and how close are you to the source, all varies. So hence, a droplet or a common regular mask, the cotton mask like the one you're holding, may be sufficient in majority of the outside settings. But in a close contact, suppose you're in an office space, we are very close, like where you are right now. I mean, of course, you have good ventilation. If you see a ventilation is not optimal, maybe a multiple layer, in the hospital setting, of course, obviously, we will wear N95 and multiple other layers of protection. When we see, I mean, I've seen thousands of patient visits, from the start of pandemic to now. I mean, I'm up close and personal, with them. So we wear a little different setup. So yes, multiple layers do work and do better, but now we're trying to convince people to wear a mask first. So yeah, and now the second layer is yes, multiple layers.
Now, in learning something about this, leading up to this interview, I understand that hybrid masks, meaning you mentioned N95 and another second mask, that maybe, for example, mixing materials, so a high thread cotton count, maybe even double layer, but plus something like a silk or a flannel, changing that actually can help. You mentioned the size of the particles. We're talking about larger particles and smaller particles that can actually get through any type of mask.
Correct. See, even there are some N100s in a research setting and beyond. We have an absolute contained devices, which is not for the public consumption. But yes, as you said, combining different materials will enhance your ability to filter out many, many particles rather than a simple cotton mask or a cloth mask to the next level of protection. It adds a layer of protection for you to contain different size particles.
And again, with N95 masks, we know there were points where even health professionals were scrambling to get those. Is it possible that wearing that second layer underneath allows the exterior layer to stay a bit cleaner? So if you have to use a mask for longer, can it extend the length of that mask?
You hit the nail on the head. There was a time when we used to be fitted, I mean, we all are fitted for N95. Not one size fits all. There is a process and a procedure to wear N95. So each person is fitted according to their size, the facial structure and everything. Now, to extend the duration of the mask, yes. As I said, there was a time when that was one time, one use. You walked into the patient's room, you came. Usually it was reserved for disease like tuberculosis, and there are other diseases where we wore N95. But here now things are different. Now I keep my mask sometimes more than a week. It was unheard of. I never fathomed in my life prior to this pandemic that I would ever use a mask again. So yes, the times have changed, and then it is still effective. That's why I wear different layers. I throw out the, regular, or the double layer mask out, and maybe use the N95 much longer.
And let's see. So obviously, with any mask, fit is very important. It's not just about materials, but the fit of the mask. So is it possible that in some cases, wearing just a properly fit masks, I mean, that's going to add a layer of protection just as a, multiple layers would, correct?
Correct. You see some people, they're masking their chin. What is it? It doesn't serve any purpose. And some, the nose is fully exposed, and we're covering them out. Yeah, it is protecting here, but the proper way to wear a mask is just to cover your nose and just go, press under your nostrils, and then you have a good seal with whatever kind of mask you have. And so minimal exposure to the environment for these layers is better. And also, if you're in an environment wearing a goggle or your glasses, also add a layer of protection so your eyes, it doesn't get to the mucous membrane or the membrane, you know.
Right. That is something I've seen some comments regarding eyes as a potential entry point for the virus. And again, that's a whole separate thing. That's why some people will wear a shield in addition. Is there a time where wearing multiple layers might not be helpful? For example, if people are fiddling with it more because it's uncomfortable, is there a time where it's not appropriate?
Well, again, personal choice aside, if you're physiologically, if it is bothering you, so then you have to take your limitations. Like if you are claustrophobic and you're unable to do multiple layers and you're able to do one layer, I think that is better than having multiple layers and then you're not able to do it properly. So, and you're so short of breath, it is affecting you physiologically. That may not be appropriate at that point.
We did have a question here from a woman who says, Linda, who says, will 2 masks harm your lungs? I can't breathe very well with 1 mask for a long period of time. Is there any evidence that wearing multiple layers could harm breathing, make it more difficult to breathe, give you less oxygen?
Well, as you restrict anything, your ability of breathing your carbon dioxide back, once you're away from the environment, like right now, I'm in my space, you're in your space. Once you get out of the public, you're not in constant contact. Unfortunately, some may, but majority of us, we move away from the sphere of contact or a personal shared space. So as soon as you're away from the shared space, you can be, taking off your mask, or you can start like, analogy of, remember, smoking is long gone and ever, so you can take a break. Like you just take a long break. You walk to an area where, you're able to take off your mask and breathe, and then you can come back to the space. Maybe as we go along, we may develop techniques where we may start doing that, because you cannot be with a mask for the entire day, working day, in a space, where you're sharing. And hopefully the vaccines and things what down the pipeline will change the dynamics of all of this. But it's still, you have to wear a mask even with the vaccination. I've been vaccinated, but still you can able to propagate the virus. So mask is still mandated with vaccine too.
We've had some questions again about wearing a mask for many hours, and you've just told us, if you're feeling itchy, if you just feel like you need to step away from it, it's healthy to remove yourself from other people, go into an open space. But for example, there have been conversations online about not being able to, like, breathing your own air, for example. I don't know if that's the best way to put it, but that recycling that air, is that a concern, having a mask against your face? Because I'm seeing several comments about that. Is there really any truth to that for a generally healthy individual?
I mean, those masks, what people are wearing, cloth mask and a simple single layer mask, you're not restricting anything. You're not, recycling your own carbon dioxide. Whereas an N95 or a KN95 or the fitted masks, where your chances of, inhaling your carbon dioxide pretty much are higher. That's the N95, which is, on the screen. That, when fitted properly, may have issues if you're waiting for a prolonged period of time. And you train, as you know, I've trained for a couple of hours for now, but that is individual resilience and resistance. So the regular mask, what people are wearing, probably will not have that many effect. But as you said, take a break. Go outside where you're not in shared space. Take a break and come back to the shared space.
And again, if people are just joining us, the conversation, and it may seem very jarring to hear after you've finally gotten maybe used to wearing one mask, the idea of wearing multiple masks may sound like, really? Like, now you want me to do what? The idea, if I'm not mistaken, is that not all masks are created equal. What we are typically using at home, we have one thin layer of cotton, it might be a thin surgical mask, it might be something homemade, maybe it has double, maybe it's really high level. The whole idea here, Dr. Gopalan, is again that we are thinking about the types of layers involved, the quality of those layers, and how many there are in terms of that the droplets that could get through.
Correct. When people are saying, I'm just getting used to the idea of having one, that is great. Please follow them. The added suggestions what we are giving is a addendum to what we have already said. Is one better than two, two better than three? Yes, in this scenario, it is depending on the particle size and your environment and where you are. One layer will still, protect you from major droplets. Washing your hands, avoiding touching the environment. If you're handling a doorknob or shared spaces, just as soon as you touch, don't touch your face or eyes. Wash your hand, and those things will also mitigate a lot of these. And based on where you are, what circumstances you are, you can adapt. Whether you want to have one, two, and if you made it this far in the same environment and the same thing, so what has worked for you. So follow that.
And there, you know what, we actually have somebody chiming in saying that they have been wearing multiple masks for months now, a surgical and a cloth. In your profession, it's, to all of us who are not used to wearing masks in our work life, in our private life, all these things, you have actually, this is not an unusual thing to wear more than one. Is that correct?
I mean, for me, with this pandemic, before this pandemic, there was no such situation existed, that we were, this is new, for everybody, for the humanity, this is a new thing. So before this pandemic, there was one N95 for certain situations and surgical mask, droplet mask for certain other situations. It was all defined. And there was no mask for outside other than people who are, receiving chemotherapy, who are immunocompromised, who did not want exposure from other people. So that was a very limited scenario. But fast forward now, this is advised to the world at large. So yes, wearing multiple masks do help, but if only you're able to do properly. If not, stick with, at least, one you're wearing and pick the best material that will protect, like multiple layer cotton mask or triple layer mask or what you can get and what you can tolerate. But wearing a one which is appropriate and which you can tolerate, fine. You can do multiple, perfect. Go ahead.
Yeah, again, a lot of the things people have been, when people are using masks properly and social distancing, that is helpful. That's already established. So the people who are going to be able to do that, it's great. This is an extra added piece of this conversation. What else do you think that we need to be thinking about? I mean, I know personally in my life, and probably many of the people watching right now, I have known people who have passed away from this virus. Who have lost their lives. I've known people who have been very, very ill for long periods of time, people who are still having that long-term effect, others who bounced right through it. And doctor, you're seeing such a broad variety. So when we're wearing a mask, it's not just about our own health. Again, this is about our neighbors, strangers, friends, family, everybody.
Right. This is a disease that is affecting the community, the world, everyone is affected by this. People who say, well, I'm strong, I'm young, this does not bother me. You got to think about it. I have patients, I have colleagues who are in their 30s with no comorbidities, and athletes who are running, who are in the fittest point of their life, have had disease, and they've taken well months into it. And I have a very good personal colleague of mine, and he was in his 30s, and he's still 2.5 months in and not able to return to work. And he was 5 weeks, 4 weeks in ICU, and this took it by storm. At the same token, I have patients who are in the 99 and 100-year-old whom I've sent them, home with no issues. This comorbidities do play a role, but you cannot pinpoint who's really going to get really severe disease, severe manifestation, young and old. I've seen every age group, every comorbidities or no comorbidities it affects. So this is not a normal disease process where we can say, okay, I'm fine, I'm young, it does not bother me. No, it, unfortunately, it might. So with that, yes, wearing mask when you're sharing a space, this is a society. We know the definition of the society is we all live together. It is not me, it is us. So when I'm in the us space, you've got to do what is right for the us. But if you're living in the wilderness, do what you want to do. You don't want to wear a mask, you don't want to, it's you. It's there is no us. So when it is an us, be mindful and be respectful of our space and just wear mask, wash hands, still good.
Yes, it really helps. We saw a comment here a little bit ago. Somebody said, think about it. The people who are in the comments talking that they won't wear a mask, they were suggesting, here it is, Denise wrote, think about it. People in these comments aren't wearing a mask or taking precautions. Why do you think we are still in this pandemic? Do you feel that if we all had better mask wearing practices, that we would emerge more quickly from the mess that we're in right now?
I strongly believe so. Look at there are countries which are more populous than us, having contained this disease in a resource poor setting, and we, as a resource rich setting and the greatest nation here, should be doing better. And I'm hopeful we as people will come together and we will do well. People, this is not an individual choice. People are taking, I think it is politicized, right, left, center. This is nothing to do with right, left, center, political views. It's a disease. It affects, all colors, all race, all political views, everything you're thinking about. It does not, it got, from the top to the bottom. So this is nothing discriminatory. It is individual. So do the right thing for everybody.
Would you like to summarize this conversation for the people who are just joining us? Again, Dr. Anthony Fauci had mentioned just days ago that it would be common sense for people to wear multiple masks or double mask. And at first, that is a very jarring thing to hear if you've just gotten used to the idea of a single mask. But just summarize again for us the argument of why sometimes in certain settings it may be more helpful to have more layers.
Right. It may be a new nuance for the public, as we as medical professionals have been doing this for a while. Since the beginning of the pandemic, we are practicing, most of us at least are practicing this. The rationale behind that is different, particle size, different environment, different setting you're in. So each mask gives you different kinds of protection. So with that, if you're having double layer, you will definitely confer more, protection. And wearing one, good. You're getting to you just getting that idea into your head and practicing, perfect. If you can, especially you're in a setting where you're in close contact, wear a double layer mask, and you've seen multiple examples and pictures of those, especially during the inauguration and other setting. There are a lot of pictures. So all varied combinations will work. And I urge you all to wash hands, safe distance, and wear a mask. If you can wear two, great. If you can wear one, perfect. Go ahead.
thank you, Dr. Gopalan, for all you do every day. We do appreciate your taking the time to join us here and answer some of these questions, and continue to answer our questions as we learn more, we hope, about coronavirus. So thank you so much.
Well, thank you, everybody. Stay safe. I think the vaccine being rolled out in multiple forms will hopefully we'll all be protected, and then we can come out of this happy, healthy, and carry on with our lives.
Yes, indeed. Thank you so much for joining us.
Thank you. Thank you.